So I want to walk you through common mistakes that I see when performing the squats, the lunges, and the deadlift. And I should also preface by saying this. People get the squats and the deadlifts confused, so I want to make sure you know how to discern between those two as well. So with your squat, what I want you to think about is to really keep the chest up, bring your butt back, and go as low as you feel comfortable. Common problems that I see with low back pain when you squat is that their hips are tight and they start to round, and then they keep going low even though their spine's rounded. So it's really important to keep your spine straight, your chest up, and go as low as you feel comfortable that you can keep your neutral spine. Now the deadlift is not the same motion. The deadlift should actually have a lot more of what we call a hip hinge, where I get your butt up and back and your arms would come down here, okay? So you can see I'm really driving my butt back. My knees are bending, but they're not moving much or forwards like the squat is. So they're bending, but my butt's going up and back. And this is where you can grab weight, drive it up, or you could progress with anything else that you could hold on to down here, like a barbell, and continue to progress. But what I want you to do right now, since you've been suffering with low back pain and you're going through our checklist, is to just make sure that you know how to properly go down into this position and that it looks something similar to mine. The last thing I'll say on the deadlift is as you come back up, make sure that your hips do the work and not your back, okay? So as you come up, I don't want to see your back arch as you come up. Make sure you're driving the hips and leading with that. And then lastly with the lunges, this should be a common everyday movement. If I go down to get something, I should be able to do that in a lunge. But a lot of my clients who are having back pain, they're not strong enough to do that. They look at me and go, I'm unable to do that. So being able to do a lunge well is really important. One of the common mistakes I see with this, in addition to just being weak, is that their knees like to cave in as they come down. So you got to keep your knees out over your feet. You want to keep your butt back a little bit. I'll show you a lateral view in a second. And make sure your weight is equivocally distributed, 50% on each side. So with the lateral view, the most common mistake I see with the spine is that it's not only vertical, but it's arched like this. And this is what I see with the lunge. So instead, get your butt back, bring your heart forwards, and then go straight down into the lunge, putting 50% of weight on each side. Make sure you're doing those functional movements incredibly well. They can really save your back in the long run.